Hi, my name's Robin Hawthorne. I'm the Continuum of Care Counsellor for Aiséirí Cahir. I first joined the organisation 16 years ago as a volunteer in the Continuum of Care programme as a facilitator, aftercare as it was known in those days. Around 10 years ago I first got involved in family work through the Continuum of Care programme and joined the organisation on a full-time basis 4.5 years ago. Addiction is very much a family illness. When you look at the number of people who are impacted by addiction, for every active addict, there's research that tells us that at least 10 people are impacted to a greater or lesser degree. Aiséirí has become much more focused in family support. Always had a focus on family support, but in recent years, through the Continuum of Care programme, has developed that to help embrace and bring family members on board. At present, we have over 100 family members actively engaged in our Continuum of Care programme. It's addiction. It's contagious. When addiction enters a family unit, it spreads, it manifests itself through family members. But we also find that recovery is contagious. In terms of as a family member starts to recover, then we find that when we talk about recovery, the behavioural changes start to spread throughout the family piece. It's just it's very, very much the hidden part, I suppose, within the addiction is the impact on families. But it's very much a focal point of what we do here in Aiséirí. When a person finishes treatment, they're in a safe environment when they're within Aiséirí, and the challenges are going back out, essentially back into a world that hasn't changed. Materialistically for the recovering addict. So he or she has to integrate back into the environment with which they're familiar. So one of the challenges is just to be able to implement the skills and the behavioural changes that they've started to develop through the 28-day programme. And remember, 28 days is not a long period of time into their lives, and hence the reason that a Continuum of Care programme is so important. I mean, we have a 2-year Continuum of Care programme to help the residents and their family members to slowly integrate those changes into their day-to-day living. The other piece that's difficult is that very often there may be some dual diagnostics and things that come up during treatment which are not directly related to addiction. So it's important that we recognise those pieces and refer on to appropriate support organisations to help that be dealt with. So it's quite a complex piece. The big piece for recovery is to change our behaviours. You know, we very often there can be the concept that when we stop drinking and we stop drugging and we stop gambling, then everything will be fine. It's far from as simple as that, and so the challenge is to sometimes to educate the family and the outside world that it's more than just the drinking, the drugging, and the gambling. That's only the start of the process. There's a very important piece that we do, and it's a piece of work that we do with the clients as they come towards the end of the treatment. Every client leaves Aiséirí with their own personal recovery plan, which is their plan, their guidebook for living. And it's a holistic plan designed around just a number of questions around support networks, triggers, but most importantly, building up a healthy routine, daily routine, weekly routine, and putting some goals, recovery goals into place. And that's the first piece, and that's a piece that comes from within the client, within the resident. He or she puts that together based on a template. So they identify it. They identify their own recovery plan. And I think that's so important. It's not an imposition. So that's in place. Within that plan then, there may be identified certain supports that may be needed. So there may be referrals onto other organisations. We have the Continuum of Care programme that Aiséirí promote, and I think that even the title is very, very important. Continuum of Care. It's a continuation of the format. So on completion of the 28-day programme, all of the residents are invited to join our 2-year Continuum of Care programme. And I use the word invited very, very, very deliberately, because it's at the core of recovery is taking responsibility for yourself. So everyone's invited to join the Continuum of Care programme. The Continuum of Care programme, it's a 2-year programme. It's based on, it is a continuation of the programme that we have here. It's based on a group format. There's a reinforcement of the 12-step programme over a 2-year period. There's a reinforcement of some of the educational lectures that we have, but most importantly, it's peer-driven, and it's learning from that. The core Continuum of Care programme is available for all ex-residents and their partners. Specifically partners, because that's a non-hierarchical piece. For other family members, we have an independent support programme called a Concerned Persons Group. We have a number of those at present. We have over 100 active members today across the country. But essentially, it's a very similar piece. With the difference in the family members have not had the same level of input. Obviously, the residents have 28 days, 24 hours a day support and learning, whereas the family members, it's limited to 1 day for a few hours through treatment. So there's an educational piece for the Concerned Persons Group. It's a 12-week rolling programme with 12 topics specifically designed for family members to learn about how they cope with addiction. It's not there to help the family members cure the addict, as some of them might hope. Unfortunately, if we could present that, we certainly would do that, but it's there to provide family support for their needs in recovery and or active addiction, depending on how things pan out. Who's invited to join the family programme? Well, essentially any family member. So whilst Continuum of Care is there for a partner, mother, father, son, daughter, anyone who's concerned and affected by addiction within the family unit is given the opportunity to join a Concerned Persons Group. One of the big challenges, of course, for Aiséirí is to get that initial engagement from the family member. That I'm okay if he or she's okay. Codependence, as the term is a barrier. But we're always promoting, and that for a family member, it's about them being free to be themselves, to move from a codependent state to an independent state. So that support piece is in play. The other strand that we have to our Continuum of Care programme is when, unfortunately, someone falls into a relapse cycle. A relapse is part of recovery. We have a separate strand which focuses on just bringing us back to the core message, back to the step 1 in the recovery programme, acceptance that I have a problem and how I'm going to deal with it. So we have a separate recovery group, or a number of recovery groups for people who are struggling to grasp full-blown recovery. But our ethos is very much in engagement and retention. When someone wants to get well, we will provide an opportunity for them to avail of one of our services, and we will support them all the way. That's the ethos. One of the big challenges, there's a number of challenges that family members experience. The first challenge is letting go of the past. Because very often, all the family member can focus on is what it's been like in active addiction. Because it's very unusual that someone comes into treatment after a month or two. It's normally been endemic within the family unit. So the first piece is just to let go and give recovery a chance, to back off, to free themselves off, to stop facilitating, to stop enabling, as what the term is, to hand over responsibility to the recovering addict for his or her life and recovery. For so long, the family member has been trying to fix things, has been trying to manage it, keep the balls in the air. And to let go of that responsibility is a big piece, massive piece. And actually to identify just how unwell, unhealthy, and again, we promote the terms unhealthy, moving from an unhealthy space to a healthy space rather than right or wrong. It's about being, so that to recognise that how unhealthy they've been, and actually to accept support and recognise that pride, shame are other areas which impact on families getting well. Being free and open and able to talk about the fact that there's addiction within the family unit. Unfortunately, there is culturally still a stigma associated in certain areas with addiction. It's getting an awful lot better, but it will take time. And to get past that piece can be difficult. Blaming themselves. What could I have done differently is a massive piece for family members. But again, that's getting around the whole concept of the illness. So being okay for recovery. So as a Continuum of Care Counsellor, no 2 days are the same. But the first piece though is preparation for the transition from treatment back into society, or onto secondary care, depending on what the journey is that the person has mapped out for themselves. So working with the residents, I start to get actively involved with the residents in the last week to 10 days, working through a recovery plan for them. There's a discharge piece that we do, a discharge group that we do in the final week with the resident and his or her family, which is really, it's about going forward. It's promoting and promoting how hope, positivity, it's instilling. For me, a big piece of my role is to engender hope and positivity, not just within the resident, but within the family member, so that when they leave here, they believe that there is a healthy life out there for them. The next piece then is to follow that up. So we have the Continuum of Care groups. We have, between family groups and the core Continuum of Care program, we have almost 50 groups in active place. My role is to liaise with all of those groups on a weekly basis. So I receive a report from each group on a weekly basis of attendees and just a feel for how each resident's doing. If there's any follow-up to be done directly coming from the Continuum of Care program, then my role is to liaise with the group member, be it a ex-resident or a family member, doesn't matter. It's to provide support. We also have structured support, so we have a follow-up meeting with the resident and a nominated family member 5 or 6 weeks after completion of treatment. Family Day is absolutely vital. First, from a number of reasons. For the first 3 quarters of the programme, then the family members come along and they tell us how addiction has impacted on them, the consequences of the resident's addiction. To give an analogy, during treatment the resident will paint a picture of addiction from his or her perspective. They'll give us the black and white image, and the family member will come along and colour that in. They'll provide the missing pieces. The resident may understand or believe they understand how their loved ones have been impacted, but they don't. They don't know everything. So the family member helps to give us the full picture, and it gives us an experiential piece on what it may be like within the family home. So just to be able to see reactions, interactions on the day can give the counselling team, the support team, a massive insight into what's going on from a behavioural point of view, because remember, it's behaviours that we're working on here. Addiction, taking out the addiction, the chemical or the addictive behaviour is only the start. It's the behavioural piece that we're working on. So it gives us that, but it also gives us a massive opportunity to get to know the families in a broader sense and to provide support for the families. So there's a therapeutic piece in the mornings with the family member and the resident, and in the afternoon there's a support piece for all the family members, giving them information, making sure first of all that there's nothing comes up for them during the therapeutic piece in the morning, but most importantly opening their eyes to how addiction is actually impacting on them, on their daily lives, and what supports are available, and to make sure that they go home from Aiséirí just being okay, feeling okay and being supported. That is so important. They're given an introduction into the concerned person support. The family members are also given insight into the 12-step supports in the community, Al-Anon, which is the equivalent of AA, NA, CA and every other 12-step programme that's out there. And it's really creating an awareness for them. And that's the big piece. If we can get them engaged and looking after themselves, that's the big piece. So there's two pieces. They bring the piece in to give us information on the client, but they also start to get support from themselves. It's really exciting. So we have the Continuum of Care programme, which is there, which all residents are invited to join. But also as part of the Aiséirí organisation, we have a secondary care programme for men and women, which is initially of a 6-month duration. As I say, it's for men and women. And really, the secondary care piece is there not only to work on addiction, but much more to focus on recovery and life skills, to provide, a number of the residents who come through Aiséirí, apart from struggling with addiction, I've just struggled to get any sort of life skills in place, and the secondary care programme provides a backbone for that piece. And we also refer on to other organisations, other addiction centres with their support groups. Really, Aiséirí are open to whatever is best for the resident or the client. He or she comes first. So we have the secondary care piece within our own organisation, but we will utilise whoever we feel may benefit the person or the family most effectively.